I often get the question, well, which one is best? Well, it really depends what you're treating. So if you have a post-concussive problem and we send you to the clinic that does photodynamic therapy, they are going to set you up with either a helmet or headgear type device because that's going to be the most specific to the place where you had your problem. During COVID, especially with earlier variants where people were having a lot of respiratory problems after, and there was some really good research done on this, which I have done other videos on. We'll probably link those down below. But what we would do with people, especially, during COVID where people were less mobile, they might not be able to get in the office or, maybe, they were still, not out of quarantine, we would have them order a red near infrared light pad that was hopefully big enough to cover their chest, and two if they could, and have them lay on one and put the other just draped across their chest. Or in the case of a lot of people that had like pelvic organ dysfunction in long COVID, we put it top and bottom over the pelvis, and then we would have them use that. If you're doing a specific orthopedic type of recovery and repair, then we would have you do a pad. And now there's all these pads that, are made just for shoulders and knees, for example, or other parts of the body. But you could just take a plain old pad that you might use for your back and you can wrap it around your shoulder or your arm or your elbow or something like that. And it's going to work just fine. So really, they all work if you get the right wavelengths, so something in the red, something in the near infrared, they're going to work just fine. And if you're looking at over-the-counter use, they're going to be very similar. Okay. You do want to do some due diligence on whatever company you buy these from. Make sure that they're legal to use wherever you live. Make sure, and then in North America, they're UL listed, so they're, safe electrically speaking, etc. And then the way to cycle them is very broad. Now, this is just what our experience is. This is not medical advice for you if you're recovering with long COVID or you have other issues that you're dealing with, orthopedic things, post-concussion. Please talk to some healthcare provider who knows about phototherapies. But generally speaking, we would ramp people up to about 20 minutes to 30 minutes of use of the red near infrared. And like when people get home from the hospital, we would do it 2 or 3 times a day on the chest or the pelvic organs, etc. After the first week, we would try and get them to do it every day for a week or two, and then we would start to spread the treatments out, depending on how quickly they were getting better. But usually 1 to 2 weeks of daily use, and then they might go to every other day or 5 days a week or something like that, and then taper off. Because remember, the goal of this therapy is to get you so that your cells are working up to normal speed again, which they're not when you're sick or after surgery or after trauma, and so that they're recovering as they are supposed to do. And